In the fall and winter, people can become depressed more quickly. And even though seasonal depression is not as bad as a classic depression, you do want to get rid of it. Today we continue to talk about seasonal depression and the most effective treatment. I will also give you tips on what you can do yourself to boost your mood, and will explain how to choose a light box. Light therapy, also known as phototherapy, is an effective treatment for winter depression. The treatment works by giving a patient a boost of artificial light that mimics the effects of natural outdoor light. Daily exposure can suppress the brain secretion of melatonin as well as increase production of feel-good hormone serotonin. As a result, you feel more awake, alert, and less drowsy. In Western healthcare practices, you can get light therapy in the fall. Starting light therapy before the onset of symptoms may even help prevent winter depression. You come by 5 to 10 consecutive walking days for 30 minutes at a time. During a session, you sit near a light box or lamp which emits bright light. Guidelines for typical bright light therapy at home will usually suggest starting with 10,000 lux for 20 to 30 minutes every morning. Using a light box in the morning can let the body know that the day has come, that will speed up the biological clock. Light therapy may be continued daily throughout the winter months to be effective. Extra light can also work well with the winter blues. Experiments are already underway with light therapy in the workplace. Light cafes have already opened in Helsinki and London, where you can also get a portion of light in addition to your daily dose of caffeine. There are many different types of light boxes which are sold in pharmacies and online. The price range from $30 to $300. When choosing a light box, remember that it is important to receive 10,000 lux of exposure. The more powerful the light box, the shorter the treatment session may be. The box should produce as little UV light as possible. The distance of exposure is usually 40 to 60 centimeters. Just follow the manufacturer's recommendations to get the proper amount of light. Using a light box, keep your eyes open, but do not stare directly at the lamp. You can read, work on the computer, or eat your breakfast during exposure. My personal experience with light lamps is positive. I don't suffer from winter depression, but it's difficult for me to get up in winter and my energy level can be low. Using light therapy for 5 or 6 years now, I feel more energized and motivated. Light glasses have also been launched on the market. They deliver blue-green light into the eyes. This type of light directed into the eye accomplished the same treatment with a lesser intensity. My friend uses these glasses and is very satisfied with the results. The advantage in comparison with a lamp is that you can move around during a light exposure, making lunch, helping your children get dressed, and so on. This is useful if you have little time in the mornings. Light therapy has few side effects like headache, nausea, tired eyes. Most of the time, these symptoms will disappear on their own. Before you start light therapy, it's a good idea to talk with a doctor or mental health professional, because this therapy may potentially interact with your medicines. For example, light therapy has been shown to be effective in up to 85% cases. If this therapy doesn't help enough, you have other options like cognitive behavioral therapy, vitamin D supplements, and antidepressants. And now let's look at what you can do by yourself to ease symptoms of seasonal depression. First of all, literally light up your life. Simply begin with bringing more daylight and sunlight in your home. Keep your curtains wide open and go outside as much as possible, even on cloudy days. You can even consider painting walls lighter colors and install bright light bulbs. You may also plan a midwinter vacation to a sunny climate if it's possible. Second, you can consider using the dawn simulator. It can be used as an alarm clock. Dawn simulator gradually turns on the light in your bedroom. Light enters through the eyelids, triggering the body to begin its wake-up cycle. In this way, you trick your body to think it's an earlier sunrise. If you're suffering from winter blues or winter depression, don't stay in bed for a long time. By staying in bed, your already disrupted biological clock will keep running not on time. The best is to get up early, before 8 o'clock. This way you give your biological clock a sign that the day has started. So you stimulate your body to wake up. Also, a good breakfast helps your body to wake up and get active. So don't skip your breakfast. Next tip, get physically active. Exercise. It doesn't matter what you do, running or walking, whatever. Choose something you enjoy. Research shows that exercise is as effective treatment for moderate depression as the antidepressants. The drug works a little faster, but exercise works better in the long run. An additional advantage of sports is that it has no side effects except for muscle pain. You can also achieve a lot with some changes in your diet. A diet rich in whole foods like fruits, vegetables, and fish can lower your risk for depression. Cut down on sugar. More and more studies find links between sugar and depression. One of the easiest ways to reduce added sugar intake is to avoid soft drinks and not add sugar to tea or coffee. Besides, check the labels when buying food for hidden sugars. Sugar can be incredibly addictive. When we eat sweet foods, the brain's dopamine reward system gets activated, thereby increasing mood, because dopamine provides an intense feeling of reward. While eating sugary food, dopamine levels rise nearly as much as they do with heroin. But a high sugar intake results in chemical changes in the body. These occur to prevent overstimulation, so the body may crave more sugar on future occasions to achieve the same high mood. But dark chocolate, 70% and more, makes us happy and is low in sugar. A study published in January 2022 found that participants who ate 85% dark chocolate daily maintained a better overall mood than others who ate chocolate with less cocoa or no chocolate at all. Cocoa contains substances which boost the production of feel-good chemicals called endorphins and lowers a stress hormone cortisol. Stress is a major cause of depression, and caffeine leads to a temporary rise in the adrenaline level in the blood. This produces a kind of stress response, so it's better to cut down on coffee, tea, and cola. Also, nicotine increases the production of another stress hormone, cortisol. Many people use alcohol trying to cope with depression. Alcohol can make us feel better for a few hours if we are depressed, numbing difficult feelings and helping to fall asleep. But in the long run, alcohol only deepens the feelings of depression because alcohol changes brain chemistry. So we can say that alcohol is a depressant despite the false short-term positive effect. It is regularly claimed that nutritional supplements help to reduce winter depression symptoms, in particular vitamin D. Whether vitamin D cures winter depression has not been scientifically proven yet, but there is no doubt that having low levels of vitamin D can impact your health. Symptoms of vitamin D deficiency can include muscle weakness, pain, fatigue, and low mood. Vitamin D levels can be checked. A vitamin D test is used to screen for low levels of vitamin D in blood. Share in the comments below your thoughts about this topic. What is your experience with Lightbox and vitamin D supplements? Thank you for your attention. See you next time.